Will I need treatment? Up to 1 in 5 women with gestational diabetes will need to take tablets and/or have insulin injections to control their blood glucose during pregnancy. Your healthcare team will advise you what treatment is best for you. If you do need insulin, your specialist diabetes nurse will explain exactly what you need to do. This will include showing you how to inject yourself with insulin, how often to do it, and when you should check your blood glucose levels. When is the best time for my baby to be born? Ideally, you should have your baby between 38 and 40 weeks of pregnancy, depending on your individual circumstances. How will I have my baby? If your ultrasound scans have shown that your baby is large, your healthcare team should discuss the risks and benefits of vaginal birth, induced labor and cesarean section with you. What happens in labor? It is important that your blood glucose level is controlled during labor and birth, and it should be monitored every hour during labor to ensure it stays at a satisfactory level. You may be advised to have an insulin drip to help control your blood glucose level. During labor, your baby's heart rate should be continuously monitored. What happens after my baby is born? Your baby will stay with you unless he or she needs extra care. Breastfeeding is best for babies, and there's no reason why you shouldn't breastfeed your baby if you have gestational diabetes. Whichever way you choose to feed your baby, you should start feeding him or her as soon as possible after birth, and then every 2 to 3 hours to help your baby's blood glucose stay at a safe level. Your baby should have his or her blood glucose level tested a few hours after birth to make sure that it is not too low. Your baby may need to be looked after in a neonatal unit if he or she is unwell, needs close monitoring or treatment, needs help with feeding, or was born prematurely. Gestational diabetes usually gets better after birth, and therefore you are likely to be advised to stop taking all diabetes medications immediately after your baby is born. Before you go home, your blood glucose level will be tested to make sure that it has returned to normal. You should have a test to check your blood glucose level after an overnight fast or a GTT about 6 to 8 weeks after your baby is born. It is important that you attend, as a small number of women continue to have diabetes after pregnancy.